Here in San Antonio, thousands of people take psychiatric medication, but a large percentage of those people may not even understand why. Well, now a San Antonio psychiatrist has launched a program nationwide aiming to change that. Eyewitness News reporter Jeremy Baker explains.
There are a lot of reasons you may not understand why a doctor gives you the prescription you get.
Their clients often ask them questions. They see them every week, they trust them, they feel comfortable with them, and oftentimes now they don't see their doctors very long.
Dr. Harry Croft launched the program in late July. The director of clinical services for San Antonio Behavioral Hospital, Mary Shapansky-Bonet, says it's not just the lack of information, but also a shortage of psychiatrists.
We've lost, I believe, 26 psychiatrists in the last 5 years, and we are so underserved. It's an enormous issue.
That lack of psychiatrists, or those that don't take a patient's insurance, leads to primary care physicians having to dive into a world of psychiatric medication that they aren't comfortable with. In fact, 80% of psychiatric drugs are prescribed by non-psychiatrists.
Zoloft was originally prescribed as an antidepressant, but now it's been found to help people with anxiety disorders and panic disorders, which is something therapists may not be aware of.
That's why Dr. Croft held this pilot seminar to boost awareness of the issue.
There's also the importance of online resources like WebMD and also the Mayo Clinic for therapists needing valuable information.
It's important for the therapist to understand the medications, what they're used for, what their side effects are.
But with this program to spread awareness of the disconnect, Dr. Croft hopes to change that nationwide. Jeremy Baker, KENS 5 Eyewitness News.